The retirement gap years, how to bridge the Medicare waiting period. Retirement is supposed to be the reward for decades of hard work. You finally get to sleep without an alarm clock, enjoy long breakfasts, travel when everyone else is stuck at work, and spend your days doing things you actually enjoy. Then reality arrives with a thick envelope from a health insurance company. Many people retire before age 65, only to discover they have entered what financial planners often call the retirement gap years. These are the years between leaving employer-sponsored health insurance and becoming eligible for Medicare at age 65. For some retirees, the gap may last only a few months. For others, it can stretch for several years. During that time, health insurance often becomes one of the largest expenses in retirement. I have noticed that many retirees spend years preparing for Social Security decisions, investment allocations, and retirement income planning, yet give surprisingly little thought to healthcare coverage before Medicare begins. Unfortunately, healthcare costs have a habit of demanding attention at exactly the wrong time. The good news is that careful planning can dramatically reduce these costs. Understanding Affordable Care Act subsidies, managing taxable income strategically, and using a health savings account wisely can make the retirement gap years far more affordable. Understanding the retirement gap years. The retirement gap occurs when someone leaves a job before age 65 and loses access to employer-sponsored health insurance. Medicare eligibility generally begins at age 65. If I retire at 60, I need to find healthcare coverage for 5 years. If I retire at 62, I need coverage for 3 years. Those years can become surprisingly expensive. A healthy couple in their early 60s might face premiums that run into thousands of dollars annually. Add deductibles, copays, and prescription costs, and healthcare can quickly become one of the biggest line items in a retirement budget. Many retirees initially assume COBRA is the answer. While COBRA allows continuation of employer coverage for a limited period, it is often a temporary solution rather than a long-term strategy. Once the employer stops subsidizing premiums, many retirees discover that COBRA coverage costs significantly more than expected. Seeing that first COBRA bill can feel like finding out your favorite restaurant charges extra for water. For many early retirees, the Affordable Care Act marketplace becomes the better long-term solution. Why ACA coverage matters for early retirees. The Affordable Care Act, commonly called ACA or Obamacare, created health insurance marketplaces where individuals can purchase coverage. The most important feature for retirees is the availability of premium tax credits, commonly known as subsidies. These subsidies can dramatically reduce monthly premiums. Unlike many government programs, ACA subsidies are based primarily on income rather than assets. This distinction creates enormous planning opportunities. A retiree could have $1 million invested and still qualify for substantial healthcare subsidies if taxable income remains low enough. Many people find this surprising. Someone with a large brokerage account may qualify for assistance, while someone with far fewer assets but higher taxable income may receive little or no help. The key measurement is modified adjusted gross income, commonly called MAGI. Understanding MAGI and ACA subsidies. MAGI determines subsidy eligibility under the Affordable Care Act. For retirees, managing MAGI becomes one of the most valuable financial skills during the gap years. MAGI generally includes wages, pension income, traditional IRA withdrawals, taxable Social Security benefits, dividends, interest, rental income, and capital gains. The higher the MAGI, the lower the subsidy. Consequently, every dollar of income matters. This creates a unique challenge. Most retirees spend years trying to maximize income. During the gap years, the objective often shifts toward controlling taxable income. That does not mean spending less. It means choosing where retirement cash flow comes from. The distinction is critical. Imagine 2 retirees each spending $60,000 annually. One generates the entire amount from traditional IRA withdrawals. The other receives part from taxable income sources and part from a brokerage account using principal that is not taxable. Although both spend the same amount, their MAGI may differ dramatically. As a result, one may qualify for substantial ACA subsidies while the other may not. Managing income during the gap years. Careful income management can produce thousands of dollars in annual healthcare savings. Traditional IRA withdrawals deserve special attention. Every dollar withdrawn generally increases MAGI. Large withdrawals can reduce or eliminate subsidies. Many retirees benefit from drawing spending money from a combination of sources rather than relying entirely on traditional retirement accounts. Taxable brokerage accounts can be particularly useful. When assets are sold, only the gain portion is taxable. The return of principal generally is not. Cash savings can also provide spending money without increasing MAGI. Roth IRA withdrawals often become extremely valuable during these years. Qualified Roth withdrawals typically do not increase taxable income. This means retirees can fund expenses without jeopardizing ACA subsidies. A retiree with significant Roth assets often enjoys far greater flexibility when managing healthcare costs. I like to think of Roth accounts as the Swiss Army knife of retirement planning. They seem to solve a surprising number of problems. The retirement gap years frequently present an excellent opportunity for Roth conversions. Future required minimum distributions, known as RMDs, may push retirees into higher tax brackets later in life. Converting traditional IRA assets into Roth accounts before Medicare begins can reduce future tax burdens. However, Roth conversions increase MAGI. That creates a balancing act. Converting too much may significantly reduce ACA subsidies. Converting too little may create larger tax problems later. Many retirees benefit from carefully calculating the conversion amount that keeps them within a favorable subsidy range. This strategy often requires annual review because tax laws, healthcare costs, and personal spending needs change. The optimal answer rarely comes from a simple rule of thumb. Instead, it comes from coordinating healthcare planning with tax planning. How an HSA can be a retirement lifesaver. Few retirement tools offer as much flexibility as a health savings account, or HSA. An HSA is available to individuals enrolled in a qualifying high-deductible health plan. Contributions are tax-deductible. Growth is tax-free. Qualified medical withdrawals are tax-free. That triple tax advantage makes HSAs unique. No other account receives all three benefits. Many financial planners consider HSAs the most tax-efficient account available. During working years, some people use HSA funds immediately for medical expenses. Others allow the account to grow for decades. The second approach often creates greater retirement flexibility. Healthcare costs rarely disappear in retirement. In fact, they generally increase. An HSA can help bridge the retirement gap by paying premiums, deductibles, prescriptions, vision care, dental expenses, and many other qualified medical costs. One of the most powerful HSA strategies involves delaying reimbursements. Suppose I incur $5,000 of qualified medical expenses while still working. Instead of withdrawing money immediately, I pay the bill from regular savings and keep the receipt. Years later, I can reimburse myself from the HSA for those qualified expenses. Meanwhile, the account continues growing tax-free. This approach effectively turns the HSA into an additional retirement account dedicated to healthcare expenses. Many retirees enter their gap years with large IRA balances but relatively little cash flexibility. An HSA can help fill that gap. Healthcare expenses paid from an HSA do not increase MAGI. As a result, retirees can meet medical expenses without reducing ACA subsidy eligibility. That combination can be remarkably powerful. Planning before retirement begins. The best healthcare strategy starts years before retirement. Workers approaching retirement should estimate healthcare expenses well in advance. Too many people focus exclusively on portfolio values while ignoring future insurance costs. Healthcare premiums deserve a permanent place in retirement projections. Future retirees should also evaluate account diversification. Having money spread across traditional IRAs, Roth accounts, brokerage accounts, cash reserves, and HSAs provides greater flexibility. Flexibility often translates into lower taxes and larger subsidies. The more options available, the easier it becomes to manage MAGI strategically. Retirement planning is often portrayed as maximizing wealth. In reality, effective retirement planning frequently means maximizing choices. One common mistake involves withdrawing too much from traditional retirement accounts in a single year. A large withdrawal may generate unexpected tax consequences while simultaneously reducing healthcare subsidies. Several retirees also underestimate healthcare inflation. Premiums and out-of-pocket costs tend to rise over time. Building a cushion into retirement projections can prevent unpleasant surprises. Some people delay investigating ACA plans until after retirement. That can limit options and create unnecessary stress. Another mistake involves overlooking HSA opportunities while still employed. Workers who qualify for HSAs but fail to contribute may miss years of valuable tax-advantaged growth. Creating a healthcare bridge strategy. The most successful retirees view healthcare planning as an integrated system. Income planning, tax planning, investment management, and healthcare decisions all influence one another. A strong healthcare bridge strategy often includes maintaining sufficient cash reserves, carefully managing MAGI, utilizing Roth assets strategically, preserving ACA subsidies whenever possible, and building a substantial HSA balance before retirement. No single tactic solves every problem. Success comes from coordinating multiple strategies. Retirees who approach healthcare planning proactively often discover they can retire earlier than expected because healthcare costs become more manageable. Others find they can preserve more of their portfolio for future goals rather than spending unnecessarily on premiums. The years between retirement and Medicare eligibility can feel intimidating, especially when healthcare costs enter the picture. Fortunately, the retirement gap years do not have to derail an otherwise solid retirement plan. The Affordable Care Act provides valuable subsidy opportunities for many retirees. Managing MAGI carefully can dramatically reduce insurance costs. Roth accounts can offer flexibility when income control matters most. Health savings accounts can provide tax-free resources for medical expenses during these critical years. Every retiree's situation is unique, but one principle remains constant. Healthcare planning deserves a seat at the retirement table. Ignoring it can be expensive. Planning for it can save thousands of dollars and provide peace of mind. After all, retirement should be spent exploring new adventures, visiting grandchildren, playing golf, learning guitar, traveling the world, or finally reading those books that have gathered dust on the shelf for years. Nobody wants their retirement hobby to become comparing health insurance premiums on a spreadsheet. Leave that activity to accountants. They seem to enjoy that sort of thing. Don't wait until it's too late. Get your financial house in order today. Get Book Read Sample Happy Retirement Planning.